So I'm going to go ahead and start here. So we're talking about visual skills for reading. And so obviously, um, this is one of my kind of favorite uh, cat in the hat books. I can read with my eyes shut. So it's kind of a silly thought. Of course, we need vision to read, but oftentimes it's overlooked in the whole learning process. So we're going to talk a little bit about what kind of visual skills are needed for good reading and why. So one of the statistics that kind of stands out to me of why visual skills are important for reading is the fact that 73% of reading disabled children have some sort of binocular vision difficulty or visual processing problem. And we'll talk about some of that today. One of the misconceptions about vision and learning in general is that most things can be fixed with glasses. Usually for eyesight. So the fact is that needing glasses for distance or nearsightedness is actually not associated with reading and learning difficulties. In fact, some of the kids that do the best in school actually are nearsighted or need glasses to see far away. So there's no association really with there. Obviously, to be able to see the board and function well, they need clear eyesight, but it isn't one of the primary factors that seems to be associated with learning difficulties. So when we think about how we often define good vision, we often think about 20/20 eyesight, and that doesn't necessarily mean that they will have, if they have 20/20 eyesight or can read a certain size letter at 20 feet away, does not mean that they necessarily have good visual skills for reading. So why is that? So I want you to think a little bit. What do your eyes have to do when you look close up? So, and not just one eye, but what are both eyes doing when you look at something closer? And then I want you to think about, how do your eyes have to focus differently when you look up close? Or do they focus differently when you look up close? And thirdly, how do your eyes move when you read? And I guess the other question would be, do they move? So when we think about the eye chart that we read, the 20/20 visual eye chart, that doesn't actually assess any of these three things. It doesn't tell us how the eyes are working together up close. It doesn't tell us how they focus on up close things, and it doesn't tell us anything about how they're able to accurately move when you read. And those movement as being the key word in all of three of those is that reading requires very precise and coordinated eye movements. So eye movements would include that what we call eye teaming, or being able to keep words single and working. That's part of keeping both eyes working together. Eye focusing, which is keeping the words clear. And eye tracking, which is keeping your place when you read. So we're going to go into a little bit more depth with all of those. So let's start with eye teaming. So eye teaming is, you have two eyes, they each have their own image, and you have to be able to point the eyes in the same place at the same time to create one picture in the brain. We don't think about what's coming from our right eye and our left eye unless we close one eye, or at least we shouldn't. They should work together to create one seamless image. But if the eyes aren't pointing in the same place at the same time, we can have a problem. Now, a lot of times, if it's a severe eye teaming issue, you'll actually be able to see the problem. You'll see the eye turn in or out. But most of the time, eye teaming is actually just, things are just a little bit off. And so the person has to work just a little bit harder to be able to get things to be clear and single. So what happens if you have an eye teaming problem? So this is what it can look like when the eyes aren't quite working together. So as you can see, it's very hard to look at. There's a little bit of doubling going on. Sometimes it stays this way, sometimes it goes in and out. And I have kind of an example of that a little bit later. Next, once both eyes are focused on the word or the page, then they have to focus, right? So they have to be able to clear the words. And we do that with a lens in the eye. So when you look far away, there's muscles that control this lens that have to relax to see clearly far away. And when you look up close, they have to do some work. Now, a lot of times, this system works perfectly fine until you reach about age 40. And then something happens with the lens gets stiffer and harder to move, we think, and then people have trouble clearing things up close. And so they go to reading glasses and bifocals, or they just have to move things farther away to get them in focus. But until around age 40, that system should actually be working pretty well. I mean, it develops when we're fairly young, somewhere around 6 months of age. So we assume that that system's going to be working well until that lens hardening starts to happen. But sometimes those focusing skills and those precise eye movements don't develop properly, or something interferes with how they're working, and then this happens. So this is what can happen when the eyes aren't quite focused on the page. So it'll look, obviously blurry. Now, it doesn't always stay this blurry. Sometimes it'll go in and out of focus. And sometimes the person will work hard, get it clear up close, but then when they look far away to clear the board, it takes a little bit longer to relax that focusing system to see clearly far away. So some kids, sometimes they'll have a problem switching from distance to near and back again. And then the third eye movement skill that's required for reading is eye tracking skills. So I have two people. This is an eye movement recording of what's happening with their eyes as they read. Actually, it's the same person. The one on the left is before they receive treatment for their eye tracking problem, and the one on the right is after treatment. So as you can see, the one on the left is a lot slower, and that little black bar, which shows how their eyes are moving, is kind of just skipping all over the place. So it'll make a big jump, and then it'll have to go back, not going to the next line and finding it very easily. It's a lot slower because of that, and things take a lot longer. So when we think about those three visual skills, the teaming, the focusing, and the tracking, and then think about those symptoms and behaviors that can be associated with those poor visual skills, it's not difficult to understand why reading can be a problem. So this little demonstration that's showing on the screen right now kind of shows a little bit of how the words might also look when you have an eye teaming or focusing problem mostly. So they could be blurry, they could look like they all run together, they could be a little double, or they could just seem like they're distorted. And I think everyone would agree, a little bit hard to look at, or a lot hard to look at. So let's take a look and see what common symptoms we see with these difficulties in these poor visual skills. So eye strain, think about eye fatigue, eyes get tired, kind of goes along with eye strain. They may get headaches. They may actually complain about blurry or distorted words, although I've found that a lot of kids don't know that it's supposed to look different. Double vision. Words might appear to move on a page. That can have to do with those eye teaming skills not being quite where they should be, and it can actually sometimes look like the words are floating or moving around on the page. Words can run together. You might also see some eye rubbing, especially when doing reading or close work. And then when we think about other visual symptoms that we don't necessarily always relate to vision, but are definitely could be related to an eye tracking problem. So omitting words, losing their place when they read, rereading words. This is a big one, requiring a finger or marker to keep their place. Usually when I get to about age 7 or 8, they really shouldn't need their finger to track across the page. Their eyes should be able to do it for them. Poor reading fluency, slower reading, and substituting words, and poor reading comprehension. The substituting words can sometimes happen because they sometimes are able to figure out what the beginning and the ending are, but the middle sometimes gets mixed up, especially with IT mean problems. Now, behaviors. So the kids that tend to be more high achievers or just will push through it, they'll get those headaches and the eye strain and those physical symptoms. But the other kids you may not always see that. But what you can see is that they're getting close to the page when reading. They're tilting or turning their head. That's to try to compensate for their eyes not working together. They might cover up one eye. And if they have a poor tracking skills, they might move their head as they read. They might need to take lots of breaks. And then think about behaviors. So if you were looking at those demonstrations before, you probably didn't want to look at it for very long. So they might start to avoid reading or chapter books. They might have trouble sitting still when reading. They might have trouble attending to near work. They might say, I can't before even trying. And they can get very frustrated very easily with school. And that, of course, can lead to some acting out and some other behavioral problems. And oftentimes, they can be labeled as having attention problems or mislabeled as having attention deficit disorder. And to talk about that a little bit further, there's actually a good study that came out that shows there is a link between convergence insufficiency, which is an IT mean problem, probably the most common one that I treat, and attention deficit disorder. So in this study, they found that kids with convergence insufficiency are 3 times more likely to have problems with attention. And when they were successfully treated for their convergence problem, they saw a significant improvement in academic behaviors, which go back to the academic behavior survey goes back to some of the things that we talked about before with avoidance and trouble getting work done. Now, there's another side of this that has to do once we get the information in and through our visual system, that we have to process the visual information. So that's really its own separate webinar, which we hope to schedule for next month, so stay tuned. That has to do with how we process visual information. So some of the things that we're going to talk about in next month's webinar would include visual directional skills, visual discrimination, visual figure ground, that's being able to find things in a crowded background. Visualization, that's picturing things in your head, and that's important for visual memory, visual sequential memory, and visual closure. So the question becomes, because I've seen lots of kids who have had an eye exam, but not necessarily had the problem identified with the IT mean and the focusing and the tracking. So who diagnoses and treats vision and learning problems? Typically, that is a doctor who has a special designation or special training beyond the normal 4 years of undergrad, 4 years of optometry school. And they will have their title FCOVD, and that's shown that they've gone through extra training to specialize in this area. So I've had my FCOVD now for 10 years, and so in our office, we specialize in not only learning-related vision problems, but vision and eye movement skills, visual developmental and pediatrics, visual processing, vision therapy, strabismus and amblyopia, which is when there's an eye, often occurs when there's an eye alignment issue, and visual consequences of traumatic brain injury or acquired brain injury and stroke. So what is optometric vision therapy? So vision therapy is basically an individualized treatment plan. And the big focus of the vision therapy is usually treating those visual IT mean, focusing and tracking skills, and then any underlying visual processing problems that are going on as well. So it's usually doctor supervised. Actually, it should always be doctor supervised. one of the things that separates vision therapy from, let's say, occupational therapy, who sometimes also works on eye movements, is that in vision therapy, we're often using lenses and prisms. As you can see in this picture, that's me with my son from a few years ago. He's 10 now, but we're doing an activity where we'll switch the lenses in front of the eyes as they do. In this case, I think it was like a word find. So that he has to change his focus every time I switch the lens. So lenses and prisms are a huge part. In fact, I would say 80% of an in-office vision therapy session is going to be done with lenses in front of the eye. The other important thing about optometric vision therapy is that it increases the demand over time. So that's really important because we want to start where they're at, but we want to get the skills to be really to the automatic stage. And I call it the riding the bike stage, so that once learned, they're not forgotten. So it needs to be so ingrained that they can just do it without thinking about it. That sometimes takes time. So a typical treatment plan would involve sometimes, well, usually 6, sometimes up to 9 months of coming into the office once a week. And then there's usually some home activities that we try to have you do at least 5 times a week. That being said, we've customized our treatment plans to fit every family, but that's kind of the typical to get the most success out of vision therapy program. The good news is, like I said, once they get it down, those skills stay with them. So it's not something that they generally have to go back to and relearn. So I know this was kind of a short presentation, but I'm going to open it up for questions. There's more information that you can find on our website, Facebook page. We also have a newsletter, and if you have somebody that's not in this area that would like to know more, the covd.org website has a lot of good information, as does the pavevision.org website. So I'm going to unmute everybody and open it up to questions. Does anyone have any questions about what I went over? Okay. Well, it looks like there aren't any questions, so I'm going to go ahead and stop the webinar. I hope you found it interesting. If you have any other questions that come up, feel free to contact us. And thank you for joining us.